Health Brigade and formerly Fan Free Clinic have served hundreds of thousands of lives throughout the years. We were the first free clinic in Virginia, and our goal and our values have always been to respond to community need and to work with those folks that are most stigmatized, people that have been alienated and marginalized.
We serve the least served, the most judged.
No matter what, if you walk through these doors and you need us, we are here for you. We are you and you are us, and we are more alike than different.
Health Brigade has always helped the community. I've came here when I've been feeling down, and these people lift me up, lift my spirits.
No matter which service that you come into, whether it's medical or mental health or in our public health services, we're going to see you as a whole human being. That approach requires a very integrated commitment to trauma-informed care, to making sure that people not only get the direct services of health care and mental health care, but also are getting the food they need, are getting the transportation, have housing, all the social determinants of health are key in really making this work. And this is one, I think, of the few places in the medical models that are out there that really does pull that whole person together. We had been given one of our grants that was to help with the building, and then we were also slated for congressional funding. Those cuts came immediately within the first month or two that Trump was in office. And we had already suffered a pretty large cut in our HIV testing program and our comprehensive harm reduction needle exchange program last July.
Harm reduction is more than needles and Narcan. It's about creating a space that comes from a place of love. Because a lot of times our participants don't experience that in the street.
There's a lot of shame involved in this kind of thing, and that really brings somebody down. And they just need someone to just tell them it's cool, man. It's fine. Don't worry about it. We're gonna get this.
Honestly, that's one of the things that inspired me to get clean, was the way that they just looked at you non-judgmental. I wasn't accessing these services very long before I got clean.
The Charlie program, which is an offshoot of Ryan White, has been completely dismantled in the entire state.
That went into the prison systems and were able to help people who had HIV that were coming out of prison and helping get them resettled.
We had these funds to do intensive work with people, pay multiple months of rent, pay security deposits and things like that. That's all gone.
The other major cut is our Ryan White program, which helps to do wraparound services and keep people in care who are chronically living and dying with HIV.
Health Brigade has helped these clients for years maintain their health, making sure that they have housing, something to eat, just being able to help them navigate resources. This program has been a major impact in the lives of the Richmond community.
The only asset we really have where we could access cash is selling our facility. But Health Brigade is not the space. Health Brigade is the culture that we have built and the services we've built, and a lot of that is out in the community, and we want to be able to get closer into the communities that we serve. I think the future for Health Brigade is one of resilience.
I feel like because we're a team of survivors anyway, that we navigate, I don't want to say better than the rest, but I will say better than the rest. Because
we're resilient.
Yes.
You have to be.
We can't sit in the problem. We have to be solution driven. So, okay, this is happening, so what do we do now?
The greatest need that we have right now is for people to get involved in the larger advocacy work and to also financially support us in any way that they can.
We always need donations. We need support. We need community.
Care is resistance.
It's unity because we're all in the same situation. And I always say that we're in the same situation, so why not come together and see what we can do for each other?